Are triglycerides a marker of risk or a causal risk factor? Evidence does suggest that they may indeed be a causal risk factor. Icosapentol ethyl is an omega-3 fatty acid. It is a pharmaceutical-grade form of esterified EPA used in the REDUCE-IT trial. 8,000 patients were randomized to receive 4 grams a day of icosapentol ethyl versus placebo and were followed for a median of almost 5 years. These patients were all on a statin and had a fasting triglyceride level of greater than 1.52 millimoles per liter, but less than 5.6 millimoles per liter. They were either secondary prevention patients or high-risk primary prevention patients, specifically diabetic patients with at least one additional cardiovascular risk factor. These were the baseline characteristics of the trial: an average age of 64, about 30% female, about 70% were secondary prevention and 30% primary prevention. Of the secondary prevention patients, it was a mix of CAD, cerebrovascular disease, or PAD. The average LDL in the IPE group was 1.9 and 1.97 in the placebo group, and the average triglyceride was 2.45, not that high. In terms of background therapy, 80% of patients were on an antiplatelet agent, and almost 80% of patients were on an ACE inhibitor or ARB, and almost all patients were on a statin as per design. Shown here is the primary endpoint of cardiovascular death, MI, stroke, coronary revascularization, or unstable angina, which was reduced by 25%. This was a large absolute risk reduction of approximately 5% and a number needed to treat of 21. The key secondary endpoint of cardiovascular death, MI, or stroke was also reduced by 26%, with an absolute risk reduction of 3.6 and a number needed to treat of 28. In terms of safety and adverse events, overall this drug was tolerated as well as placebo and was as safe as placebo. There was a slight increase in hospitalization for atrial fibrillation or flutter. However, there was a significant reduction in stroke in the overall trial. Interestingly, there were significant reductions in ischemic events in all 3 tertiles of baseline triglycerides, including the lowest tertile. In summary, icosapentol ethyl is indicated to reduce cardiovascular risk in statin-treated patients with elevated triglycerides who are at a high risk due to established cardiovascular disease or have diabetes with at least one other cardiovascular risk factor.